Welcome back, beautiful tri-state area. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. I'm your host, Zen Sams. Up next in the Going Deep segment, brought to you by CO2 Lift in our Expert on the Microphone series. Today we're joined by Julie Wuis, otherwise known as the Queen of Face. She's the owner of the Face Institute in Alberta, Canada, and she's a highly experienced injector and clinical trainer with over 11 years in the field of medical aesthetics. As a faculty member of Allergan Aesthetics and Canada's spokesperson for Emerage Skin alongside Dr. Jason Emmer, Julie plays an influential role in shaping the industry. She's a frequent speaker at international medical aesthetic conferences and has been featured in numerous publications for her expertise and contributions. Today, she's brought her expertise to our show to chat all about the most popular injectable trends in Canada, evolving patient preferences, and how CO2 Lift fits into her treatment plans. Welcome to the show, superstar.
Thank you so much, Zen, for the wonderful introduction. I'm so happy to be here.
So excited to have you on. Let's dive right in. So, Julie, you are renowned for your expertise in natural rejuvenation and full facial balancing with a commitment to delivering transformative yet natural looking results. Fittingly, in recent years, we've seen a noticeable shift in the aesthetic industry with patients prioritizing those subtle refinements and enhancing their natural features rather than that dramatic, overdone look of the past. Now, based on your experience, where do you think this more natural preference is stemming from? And do you find aesthetic ideals varying between Canadian and American clients?
I believe this stems from a few cultural shifts. First, being that patients are more self aware, they're more educated, they're doing lots of research, especially with social media. They're not just blindly following trends anymore. So, there's been a real movement in the aesthetic industry towards celebrating individuality, wanting to look more like yourself, more refreshed and natural versus completely transforming yourself. So, secondly, in the aesthetic industry, there's been a large shift in our educational practices. So, I would say about a third of my day is dissolving previous filler that was done about 10 years ago. And we are redoing the filler with these new techniques. Now, a lot of patients these days are wanting this natural look and they shy away from the aesthetic industry because of these old practices. But with the new education that we've received in aesthetic medicine, we're able to achieve natural outcomes. And there's a big misconception where patients feel they think it's about the amount that's being done, but it's not. It's actually about the technique. So there's an undeniable change in these past few years of being able to get this shift to more natural results. And when we compare to Americans to Canadians, I would say that Canadians are always looking for more acceptable results, where Americans in more urban cities are looking for more transformative results. But still, across the board, we're looking for more authenticity and natural beauty. And as a practitioner, I wholeheartedly embrace this change.
You're right. And with so many options available from neurotoxins to fillers to biostimulators, how do you determine the best approach for each patient? And what are some of the most popular injectables per se in the Canadian market right now?
So we have an aesthetic toolbox we work with, and a lot of patients ask, "What is the right product for me?" But it's more so looking at the patient in front of me than anything. So things such as, what is the downtime they're looking for? Do they want immediate gratification? What are the issues they want to address? For us, the most common would be HA fillers, hyaluronic acid. Neurotoxins are for smoothing dynamic lines, and biostimulators are the new and upcoming, where the body stimulates its natural collagen to create a more natural result, fitting to the new cultural change.
Now, let's shift to regulations. Could you briefly describe the regulatory landscape of the aesthetic industry in Canada
Mhm.
and how it compares to other countries, and additionally, how it impacts the availability and access of products?
So, Health Canada is recognized globally as one of the most strictest and diligent regulatory bodies when it comes to pharmaceutical and medical aesthetics. But what does this mean for patients and practitioners? Well, for practitioners, unfortunately, it takes a long time for us to get access to certain products that America and Europe has access to faster. But on the upside, it prevents a flood of untested or lower quality products. So the rigorous process safeguards the integrity of the industry as well as our patients. So, sometimes it's not fun when we hear about something that's across the country somewhere else in a different state, but we have a little bit more of a stricter handle on things in Canada.
Now let's bring CO2 Lift into the picture, a product I know you are very familiar with. As we know, carboxytherapy has been around since the 1930s, injecting carbon dioxide gas underneath the skin. But CO2 Lift was able to remodel this in a new delivery system as a topical gel mask. And while it has many monotherapy benefits, it can also be used in combo therapy, both pre and post procedure. How does CO2 Lift fit into your broader aesthetic treatment plans, especially for injectables? And have you firsthand seen it improve a patient's results in recovery?
Yeah, so CO2 lift has been a game changer in my practice for skin health as well as recovery. So, for those that are unfamiliar, carboxygel works by delivering carbon dioxide to the skin, which triggers natural oxygenation of the skin. So, in my practice, we use it before injectables as well as after. So, why? Because it improves the circulation and hydration of the skin to allow filler to get the best optimal outcome. And then the after is that it reduces swelling, bruising, as well as patients leave the clinic with a glow rather than the telltale treated look. So it just removes downtime in a pinch compared to a patient waiting days to weeks for a bruise or swelling to heal.
It's a great product overall. Yes, I
Yeah.
attest to it. I use it myself. I love it. Now, I know you frequently speak and share your knowledge on advancement complication management and treatment planning and product integration. And while most injectable complications are preventable, they can still occur. So I've heard from many of your peers that they turn to the CO2 lift mask when injectable issues arise. And
Mhm.
with your extensive experience, I'm sure you've seen it all. So I'd love to hear from you. How do you approach managing complications with products like CO2 Lift, whether it's addressing common concerns like redness and swelling or something more serious, such as a vascular occlusion?
Yeah, so definitely have seen it all in this industry in terms of complications. And one thing I always stress to practitioners, no matter how skilled or careful you are, is that complications are going to happen, but it's how you manage it. So, most commonly, patients will experience swelling, redness, and bruising after a treatment. And this is where the CO2 lift is invaluable in my kit because it decreases all that inflammation within an hour. So that's for us for patient retention and for patient experience. It's a phenomenal product. And then more rare instances where if we're having a serious complication such as a vascular occlusion, which means there's an emboli in a vessel from filler injected, this is critical for an immediate action where we use hyaluronidase to dissolve it. But the CO2 lift, I'm sure you've heard this before, Zen, it acts as a hyperbaric oxygen chamber. So we're able to topically apply it to the face compared to sending a patient to a Medi Center and trying to pull resources, which is very expensive and very challenging to get for a patient. So it helps resolve complications while following a proper protocol and also supports the skin's recovery, specifically afterwards if there is more of a serious complication and we're wanting to restore that skin barrier.
Now, as the aesthetic industry continues to evolve, new techniques and technologies are always emerging, and professionals like yourself are at the forefront of this ever changing landscape. I know you most recently completed your Master's of Nursing Family Nurse Practitioner program. Congratulations.
Thank you so much.
And you're going to continue, of course, to focus on patient education because that's key. Mentoring other practitioners, I think, is truly important and at the heart of it all. And of course, driving innovation in medical aesthetics. So, as someone who clearly values continuing ed and innovation, how do you stay up to date in Canada's aesthetic industry? I mean, especially in an era of such rapid advancements. And secondarily, why do you think it's so important for both practitioners and patients?
So this is the area I'm probably most passionate about because the pace of innovation in aesthetics is astonishing. There are new techniques, products, safety protocols, and patient expectations are ever evolving. So for me, staying current is not optional. It's a professional responsibility. So for myself, I regularly attend different national and international conferences to engage in advanced training, as well as meeting other experts in the field. So for us, we need to dissect uh, trends as well to ensure that we're providing the best care for our patients, because things become a fad and later we realize it wasn't the best. So we have to always dive into the science to ensure that that doesn't happen, because medical aesthetics is not just beauty, it's actually healthcare. So if patients are trusting us with their appearance and their health and well-being, we have to invest in that time. um, and at the end of the day, right, that ongoing education for us fosters trust and ensures that that ripples into the entire industry.
I love it. Thank you so much. That's an incredible narrative, and I love the ethos of everything you stand for. Because if practitioners took the time to be more thorough, more educated, to continue to educate themselves and others, we would have less, less a lot of the preventable things that we say are preventable would actually be preventable, because it really just starts with the practitioner.
Hmm. Oh, I completely agree, Zen. And I think being a practitioner of a patient, if you are more informed, more thoughtful, more intentional, that is the key to getting the best outcomes for our patients. So I truly thank you for having me on today. And it's been such a pleasure to share these insights.
That was our Going Deep segment, brought to you by CO2 Lift, and that was the incredible Julie Wuis, the Queen of Face. To learn more about her practice, head to thefaceinstitute.com and definitely check her out on the gram at thefaceinstitute.ca and at the Queen of Face. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. We'll be right back after this.
A Moment of Zen is brought to you by CO2 Lift. As we age, our skin loses moisture and elasticity, causing wrinkled skin. You can reverse this aging process with CO2 Lift. CO2 Lift utilizes the powerful benefits of carbon dioxide to lift, tighten, and regenerate your skin. This simple, painless at-home carboxytherapy treatment is scientifically proven to reverse the aging process. You will see reduction in wrinkles, increase luminosity, and improve pigmentation, sagging, skin tone, and radiance.
For more information or to order CO2 Lift, ask your skincare professional or go to co2lift.com.